Hello, this is Dr. Jason Tripp bringing you the coronavirus daily tips today. The coronavirus daily tips and updates are to protect and support you and your family as you go through this hard time. So what I'm going to do is actually shift out of here, and I want to take you to the CDC website. And now right here on the Centers for Disease Control and Prevention, you can actually go use this as a resource. We're going to be going over some of these things. Symptoms and testing, like what if you think you have it. It says if you think you've been exposed to this coronavirus and develop a fever and symptoms such as coughing or difficulty breathing, call your healthcare provider for medical advice. So that'd be your medical doctor. Now, what symptoms are we watching for? So the reported illnesses have ranged from mild symptoms to severe symptoms and death for confirmed coronavirus disease in some cases. The following symptoms may appear 2 to 14 days after exposure. You could have fever, cough, shortness of breath. So much like any other flu that you might have. What they're wanting you to look for is if you have the fever, cough, shortness of breath, look for the emergency warning signs so you can get immediate help. Now, that would be difficulty breathing or shortness of breath, persistent pain or pressure in your chest, new confusion or inability to arouse, bluish lips or face. So up here, we're looking at some of the symptoms that you might have if you have that problem. What I've been talking to some of the health professionals in the area, and what they're saying is if you have these symptoms, you should stay home and rest. But when you get these symptoms, they want you to definitely get in right away. You need medical attention. Shortness of breath, persistent pain or pressure in the chest, new confusion. So if they're confused for the last 3 years, that's not new confusion. But if they have new confusion or inability to arouse, in other words, you can't quite get them to get from a drowsy state to fully alert. Or if they're bluish lips or face, they might not be getting enough oxygen. This is not all inclusive, so if you're concerned or what have you, then contact your medical provider. One of the main things is don't panic. Listen to the information, kind of be aware of what's going on around you and what you're feeling. And then if you have these emergency warning signs, you definitely want to get in to be able to talk to your doctor about what's going on. So this has been one of the 10 steps, one of the daily tips for the coronavirus. If you need anything, any help, advice, or and you have any questions, you feel free to call the office, my office, Dr. Jason Tripp, at 724-342-2225.